Welcome and thank you for choosing Smilow Radiation Oncology for your radiation therapy care. This video will provide you with an overview of what to expect during your radiation therapy treatments using SCINTIX biology-guided radiation therapy, also known as BGRT. SCINTIX therapy is FDA approved to treat lung and bone cancers. Smilow Cancer Hospital in New Haven is the first in the Northeast and one of the first in the United States to offer this revolutionary new type of radiation therapy to treat cancer. We take great pride in providing the most advanced technologies, giving our physicians the very best tools to fight cancer. In addition to our physicians, we have a team that includes nurses, radiation therapists, dosimetrists, residents, nuclear medicine technicians, physicists, dietitians, social workers, and spiritual service. We all work together to provide you with comprehensive, safe, and effective treatment designed specifically for you. Our goal is to provide you with the best experience possible. BGRT is the first and only radiation therapy that allows cancer itself to direct its own treatment. This breakthrough technology can treat patients with primary or metastatic tumors with automated motion management. BGRT therapy can shrink the amount of surrounding healthy tissue exposed to high-dose radiation. By reducing the dose to healthy tissue like no other system, patients experience fewer side effects of radiation. There are 5 steps in the biology-guided radiation therapy process: consultation, CT simulation, modeling session, treatment planning, and treatment. The first step in the process is a consultation with your radiation oncologist. A consultation is your first appointment where we discuss your diagnosis and if you are qualified for a modeling session for BGRT radiation therapy. Your consultation takes place with your radiation oncologist on your care team. A family member or friend is welcome to attend this visit with you. This initial consultation appointment can take from 1 to 2 hours, depending on your individual needs. During your consultation visit with your radiation oncologist, you can expect the following. Your vital signs will be taken. Your medications, medical, and surgical history will be reviewed. This may have been done at other offices, but it's important for us to be sure your information is complete and up to date. Your radiation oncologist will conduct a physical examination to assess your cancer-related symptoms and general health. There will be time to ask any questions, but it may be helpful to come prepared with questions to your appointment. If your radiation oncologist decides to move forward with the modeling session for SCINTIX radiation therapy treatment, you'll be asked to sign an informed consent stating that the possible side effects and benefits of treatment have been reviewed and that your questions have been answered. The radiation oncology nurse works closely with the doctor and other members of your healthcare team to provide education about radiation, to help manage any possible side effects of the treatment, and to help coordinate your overall care. You will meet with your radiation oncologist and nurse weekly during your treatment. If you have any questions at any time, we encourage you to ask your doctor or any member of our radiation oncology team. Your radiation oncologist might discuss if you are a candidate for clinical trials. The second step in the process is simulation. Before your radiation treatments begin, you will have a simulation appointment. Simulation uses a CT scan of the area of the body to be treated so that your radiation oncologist and radiation team can develop a precise treatment plan individualized just for you. During your simulation visit, you can expect the following. For safety, we will check your identity using a wristband and also take a face photo that we attach to your electronic medical chart before the CT scan is done. We will also verify with you the specific area of your body to be scanned. The first step of the simulation involves laying your body in a position that can be recreated each and every time you are treated. Positioning is very important in radiation oncology. The goal is to get you in the best position for treatment while providing as much comfort as possible. We will use soft Velcro straps for your safety. Various custom positioning aids may be created during the simulation to ensure accuracy and to aid in the planning of your treatment course. During this simulation, the radiation therapist, radiation oncologist, and other members of your healthcare team will move between the simulation room and the simulation control room working on your treatment plan. Once in position, we will mark the area of interest designated by your radiation oncologist. The mark will be our reference point for future treatment. These marks are used daily to align your body to the same position that you are in for the simulation. We use either permanent marker or small tattoos, no bigger than a freckle. One of the last steps in simulation will be taking photos of those marks and the treatment area so they can be referenced by the therapist that will be treating you daily. These images are then loaded into your electronic medical record for use at each of your treatment visits. At the end of the simulation, your treatment appointment schedule will be given to you. Your radiation oncologist determines when you start, but we always take into consideration your preference for time, as well as other appointments such as chemotherapy. The entire simulation process takes 45 to 60 minutes. The third step in the process is a modeling session. Prior to a BGRT treatment, you will come to the radiation therapy department so your radiation oncologist can determine whether your tumor produces significant signals to benefit from SCINTIX therapy. This information is needed to plan whether BGRT can be used to treat your specific cancer tumor. You will meet with a radiation oncology nurse. They will take your weight, draw blood to test for glucose levels, and place an IV to prepare you for the medication injection you will receive. After the preparation you receive from the radiation oncology nurses, they will take you to our nuclear medicine department, where you will receive an injection of a radiopharmaceutical called radiotracer that allows imaging of your tumors. After your injection has been received, you will be brought back to the radiation oncology department by the nuclear medicine technician, where you will wait comfortably in a private room. After 60 minutes, the radiation therapist will position you on the reflection machine to collect the unique live signal information from your tumor or tumors. No radiation is delivered to you during your pre-treatment procedure. As cancer cells in the tumor absorb the radiotracer, they generate signals. The BGRT therapy machine detects these signals and uses that information to localize the tumors and determine in real time where to target radiation delivery. The fourth step in the process is the treatment planning. Your Smilow physicians review the SCINTIX data to determine whether and how best to treat your specific cancer. Your plan will be discussed with you and all your questions answered before treatment begins. The treatment planning process is highly personalized. Our medical dosimetrists have a thorough knowledge of radiation oncology and medical physics. We use this knowledge to design radiation treatment plans according to the radiation oncologist's prescription. Before you start your treatment, your radiation oncology team spends many hours or days collaborating on your specific treatment plan. The last step in the process is your treatment session. You will receive the same preparation as you did on the day of your modeling session. The radiation oncology therapist will position you on the reflection machine for treatment. Positron emission tomography, typically known as a PET scan, and computed tomography, typically known as CT scans, will be taken to ensure that nothing has changed that would require your physician to modify your BGRT treatment plan. During your treatment, we follow strict safety protocols. For safety, each day before you receive your treatment, we will identify you by giving you a wristband with your name and date of birth, and compare your photo that was taken during CT simulation. Each day, the radiation therapist will position you on the table using the marks placed on your body or positioning device created during the simulation. This ensures that you are in the correct treatment position. We will use soft Velcro straps for your safety. Because we are using radiation, the radiation therapist will leave the room and ask you to remain still. Your therapist can see and hear you at all times. Each treatment can typically take about 60 minutes. Once you're in the correct treatment position, the therapist will step out of the room. The door will close and your treatment will begin. The door must remain closed for safety during your treatments. You will hear the machine as it is delivering the prescribed treatment, but you will not feel anything, similar to other types of procedures you may have had previously, such as a CT scan. While outside of the room, the radiation therapist will constantly be monitoring you through audio and video equipment. After your BGRT treatment, you'll be safe to carry on regular daily activities unless otherwise instructed by your doctor. Depending on how many treatments your radiation oncologist prescribes, you may see your radiation therapist up to 5 treatments. As always, we encourage you and your family to ask questions at any time. We hope that you found this video helpful in answering your questions and preparing you for what to expect during your BGRT radiation therapy treatments. We understand that this is a sensitive and challenging time for you and your loved ones. You can trust that we will do everything possible to keep you safe and comfortable during your treatments. We thank you for choosing Smilow Cancer Hospital for your care.